Thank you, Rebecca. I'd also like to offer my welcome and appreciation to everybody who's here, some familiar faces and some new faces. Thanks everybody for taking the time to be with us. In particular, I'd also like to recognize members of the NeuroPace board that are here with us today. Frank Fisher, our board chair. Thank you, Frank, for being here, as well as a couple of very valued advisors from the board, Rocky Kumar, as well as Uri Geiger, folks we rely on a lot. And so we're thankful for their commitment to be here with us today too. My plan in this section of the agenda is to lay out the business, where we are today and where we're headed, both currently as well as part of our long-range plan. So that's where we're going to spend the day, is we're going to tell you a little bit about the business, but we're going to really focus on where we're headed strategically and what those plans look like, and how we're both in a strong fundamental position as a company, as well as really well positioned for growth here over the next 3 years, which is the long-range plan period that we'll be talking about today. So with that, we got a lot to cover. I'm going to jump right in. Of course, starting with forward-looking statement slide. Please, everybody, recognize and pay attention to those elements. Starting and talking to the business and introducing NeuroPace, it's important that we start with what is really the foundation of the business and what animates and catalyzes everything that we do, and that's the mission of the business. And you can feel when you talk to folks about NeuroPace, you can feel the sense of stewardship that people have toward what we do to help the patients that really need it and what we can do with the RNS system. It's one of the reasons we're so excited about today is the opportunity to tell you the story about RNS and where we're headed. I was talking with Dr. Morell earlier, how excited we are for today for the opportunity to tell you that story. And it really starts with how excited we are to be able to help fulfill the mission of the business, which is to transform the lives of patients that are suffering from debilitating seizures. And it matters if we do so, and we're in a strong position to get at it. So we got a lot to cover. I'm going to jump right in. As I mentioned, we start with the business in a strong fundamental position. Those fundamentals have been hard won over a number of years, but are now in place and really address a significant unmet need. So the unmet need that we recognized in the mission of the business discussion is one that is then evidenced here with a large underpenetrated market. So our core market in excess of $2 billion for the patients that go through comprehensive epilepsy centers every year from an incidence perspective, and north of 50 billion in a total addressable market when we think about the number of patients that are drug-resistant epilepsy patients and the treatment gap that exists today. You'll hear us talk about the treatment gap. We'll talk about the treatment gap in terms of what that means for patients, what the opportunity is then to help those patients with the business, and then what we're set about doing about it in terms of the key initiatives we have underway. And in addition to the solid fundamental of an unmet need in a large market, we have a very solid fundamental in terms of the differentiated, unique nature of our technology. We have the only closed loop brain responsive neuromodulation system. It's a few long words, but there's a whole lot that goes behind that. And we're going to spend the better part of the day unpacking what that means in terms of technology differentiation, data development, and then opportunities that affords us. So speaking of unique technology, why do we think it's differentiated? Well, it shows up in the data. The clinical evidence shows, and we've got more of it coming, and we'll spend a whole section here today talking about the differentiated outcomes that we continue to see over time. We'll talk about additional data, some things that we haven't talked about before that you'll hear about today, as well as some forward-looking trial work that we're planning on as well. So those are the fundamentals, but the fundamentals are then accentuated with the execution focus that we have in the moment. So we've been generating some momentum, really focused on revenue growth, gross margin, and operating expense discipline. We've got the flexibility from a balance sheet perspective to support our operating priorities, and we've got a number of future growth opportunities that we see that we'll spend time on as well. So as we think about that, where have we been? So most recently, 2024 in review. I saw some of you at JP Morgan recently. We talked about some of this, but not all of it. So do pay attention. There is new stuff. And starting with, a revenue growth profile in excess of 20% in 2024. We've announced, or pre-announced rather, the range. We haven't given the full readout yet on Q4, but the range is 79.4 to 79.9. Growth in excess of 20%, 21 to 22%. And if we adjust for that, if we hold for the sales in 2023 that we got from the implants associated with the Nautilus trial, growth was actually over 25% in the overall business. So a strong growth momentum that accelerated throughout the year. We grew faster in the second half of the year than we did in the first half of the year. And so we've got some good momentum from a top line perspective. And we held on to the discipline with gross margins at the high end of the range, as well as operating expenses at the low end of the range. From an operating perspective, we also executed, with regard to our market development strategies, new prescribers at record highs for the year and every quarter throughout the year. So we continued to retest increasing numbers of active prescribers, began to demonstrate momentum in the second half of the year with regard to our site of service extension with Project Care. And then it might seem like a while ago, but it was only in Q1 of 2024 that we completed implants in the Nautilus trial. And we'll talk a fair bit this afternoon about a bunch of the product development work that we've been doing as well, where we've initiated development with a software in our AI-enabled software tools that we're really excited to tell you more about. So some good momentum in 24, and we're just getting started. And so what we're getting started on is where we're going to spend the rest of the day. And starting with where are we headed? Well, where we're headed with the business, the vision for the business is to be the recognized leader, to be the standard of care in the space for drug-resistant epilepsy patients, and to fully develop the potential of the system that we have today, both for epilepsy and beyond. So that's where our focus is as an organization. When we think about that focus, there are really three key pillars that we want you to keep in mind. One, it's growth story, both a market expansion, a market growth story, as well as a revenue growth story. We've got indication expansion, site of service expansion, patient and referral network expansion, as well as increasing adoption and utilization in our current level 4 comprehensive epilepsy centers that are all drivers that are underway during the plan period. They're all in flight today that are going to allow us to expand our markets and increase our revenue profile. So it's a growth story, but it's a growth story with discipline and financial discipline that you've seen from us in terms of focusing on gross margin improvement, executing from an operating expense allocation perspective, and then both investing in our organization, but also getting leverage from that investment as well, in particular in our commercial team. As we expand indications, that same organization and those same call points allow us to expand and get leverage from our commercial organization. And finally, it's execution story. We are absolutely focused on execution. One of our core values is results orientation. And so we've got a lot of potential in front of us, but we're also very focused on the discipline that goes along with executing on that potential, and then operating execution. When we think about the growth initiatives that really support that growth story, we're going to spend time today talking about 3 areas of development that are underway to really fund that growth: clinical development, product development, and market development. From a clinical development perspective, we're going to talk about some new data. We're going to talk about our post-approval study data in our adult focal population that has now been submitted to the American Association of Neurology for publication and presentation. We're going to give you the first tour of that data today, those of you who are in attendance. We'll talk to you about Nautilus and give an update on status with regard to completing follow-up in Nautilus. We're also going to talk to you about a new strategy and approach that we have for expanding indications into pediatrics. We haven't talked to anybody about that, but we've got an approach for further expanding into the significant segment of the pediatric focal market that we call our NEST initiative. We also haven't talked about very much, and are going to spend time talking about our software development program and our annual cadence that's set up in the plan with AI-enabled software tools, remote programming, and our next generation platform to enable efficiency, easy use, and increased efficacy for the platform. Those are all new things that we haven't talked to you about at all. And one of the reasons we're excited about being here today is to tell you about our product development platform that we've been working on as well. And then finally, our market development efforts. Salesforce expansion, site of service expansion, and direct-to-patient expansion are all things that we'll cover as part of that. When you roll it all up, this is what the plan looks like over 25 to 27, a series of increasing and reinforcing growth initiatives that over the long-range plan, over the period of 25 to 27, we plan and have targeted to exceed 20% CAGR over the plan period. And as you can see here in 25, we've got multiple drivers that we'll spend time talking about, including our core customers, expanding awareness and education, as well as new product launches and clinical trial submissions. In 26, expanding on that with launches into IGE and pediatrics, as well as further launch into the product development portfolio. And then in 27, really accelerating. So further penetration into those segments, launching remote programming, as well as enhanced user interfaces, and continuing to build on the growth that's in place today. Today's business generated over 20% growth in 2024. We're fixing to continue to do so and to accelerate over 25, 26, and 27. And so we'll spend the balance of the day really putting some color around each of these things for you. In the end, these are our objectives over the next 3 years. To be the recognized market leader with revenue growth of in excess of 20% CAGR over the plan period, execution on indication expansion into the meaningful segments of drug-resistant epilepsy patients. There's a meaningful segment. We want that segment covered by RNS. And we're going to develop the data and the indications to do so, really leading with IGE, idiopathic generalized, and pediatrics. Third, the category leader in efficiency and easy use, leveraging both our AI tools as well as remote capability to do that. We have a fundamental opportunity to take the capability of the system and make it more scalable and efficient, both for customers as well as, then, as I talked about, organizational leverage, what we can do with our own organization to scale penetration of the implants and make support of these patients more efficient. Expanding awareness as well as access to RNS through direct-to-consumer campaigns and care. And in the end, doing all that, exiting the plan period with the business in a position of being cash flow break even. And that's what we're going to do over the next 3 years and is laid out in this plan and what we're excited to spend the rest of the day telling you about.